going to talk about this approach, this fractional transbrasion approach, which really takes technology that's part and parcel of every one of our offices, whether it's a microdermabrasion machine, a micro roller, an LED technology, and we use all of them in the offices, and yet it puts it all in one machine and allows us to diversify its use on all areas of the body and at the same time deliver a variety of products. So anyway, so this is the machine. It's fractional transbrasion. It's a novel, totally non-invasive, desquamating and microneedling technology. So as I said, it's particleless microdermabrasion and microneedling in the same machine. It's the first to combine in one treatment, newest and most effective modalities in skincare. And so what are they? First, it's this 3D cellular desquamation by MIRApeel with the MIRAbraser. So think of this as particleless microdermabrasion, if you will. At the same time, and we generally do these things together, we'll do the MIRApeel with the MIRAbraser first, and then follow that with this fractional transbrasion, which allows us to do, again, think of it as microdermabrasion, but we can deliver serums at the same time. So those are the MIRApeel serums. And then after that, microneedling, fractional skin microneedling. And so we've got skin rejuvenation with the MIRApeel, using the MIRAroller, which is the microneedling device. Throw in the topical serums, the MIRAJolie, and then lastly, use LED technology. And I've done a lot of work with low-level light. I find it fascinating. It's sort of an all-in-one machine, and that's why it's so perfect for really any aesthetic practice. So the applications are never-ending. Acne we use it for all the time. Photo damage of all kinds can be treated with this. Actinic keratosis is actually terrific for melasma. Prior to photodynamic therapy and PDT treatment, this can be used. We often combine it with IPL treatments, intense pulse light treatments. It can be used with mesotherapy. I don't do that. So what's going on? You know, damaged skin basically has a thin outer layer, that's the epidermis, and real messed up deeper layer, that's the dermis, that's solar elastosis. And so this fractional transbrasion approach is removing the outer epidermis, if you will, with the MIRAbraser. That exposes stratum corneum, so the outer layer of skin is being removed. So at the same time, you can deliver these products. These products, salicylic acid, let's say for acne, hyaluronic acid, because that's sort of a moisturizer, if you will, soaks up water. I mean, how is it that the hyaluronic acid fillers work so well? Part is the fillers, part of it is HA, hyaluronic acid, soaks up water. So it's a super duper moisturizer. Then if you want to go beyond that, then you use the MIRAroller. That opens up the pores, if you will, and goes even deeper into the dermis, because those needles are anywhere from 1/4 to 1 millimeter, depending on what you're trying to treat. And then again, you get more of these products in there, depending on what you want to use. I talked about the tips, now let's go into them in more detail. So we've got this MIRApeel desquamation with the MIRAbraser. So the MIRAbraser are these particleless microdermabrasion tips. And you can be pretty specific about what you want to do. You can treat young, old, male, female, various different skin types and colors. You can get really super abrasive and not so abrasive. But, and this is unlike the other types of microdermabrasion machines I've used forever, I can now treat the body or the face. So the small tips of the face, much bigger tips of the body, and generally I'll get the more abrasive tips on the body, so you can treat larger areas, and it doesn't take very long to treat a full back. All right, so which grit do we choose? So I said you choose small tips for the face and large tips for the body. So you adjust the level of abrasion. How thick do you want that epidermis that's being removed? Obviously, if you're working around the eyes, it's going to be very fine grit. If you're working on someone's back, it's going to be a thicker grit. And then the handpiece itself, it really glides, okay? So it's very easy to go over curved areas. There is, while you're doing this, a brisk whirling flow of serums if you want. I mean, you could do it without the serums, sort of the old-fashioned microdermabrasion. But generally, we're going to do it with serum. So as you're doing this, the serum is whirling through it, and that happens immediately after the abrasive peeling. As the skin is being removed, there's a gentle vacuum that allows the serums to come up through the system and also allows the skin itself to get in contact with the actual tip. The handpiece is a dual handpiece. You can attach the MIRAbraser, the microdermabrasion tip to it, and you can attach the MIRAroller tip to it, and then these serums are delivered through either and or generally both tips. I'm always concerned about sterility and safety. As I said, these are single-use tips. You never have to disinfect anything. Anything touching the patient is a consumable, it's discarded, and the concept is that every patient obviously will have their own tips. So here's some videos, and so this is something we just, even 10 years ago, didn't treat large areas. but now you can treat these big areas because of these big tips. All right, so that was the MIRApeel part of the MIRAbrazier. So now's the MIRArollers. This is the microneedling part. And so we have microinfusion rolling abrasive devices. This leads to vacuum-triggered diffusion. So if with the MIRAbrazier, which is the microdermabrasion part, you take off some of the epidermis, you're delivering serum, but you're not delivering deep channels into the dermis. This is the part that creates those deep channels into the dermis, anywhere from 1/4 up to 1 millimeter, depending on the area you're treating. And you can deliver a whole variety of things. I mean, anywhere from hyaluronic acid to vitamin C, salicylic acids for the kids with the acne, kojic arbutin is for somebody that say has melasma or photo damage. So it really becomes a clinician-driven procedure, and most of what we do is sort of 6 to 8 weeks. So they come once a week for 6 to 8 weeks, and then we tend to repeat that about every 6 months to a year. And so you're really optimizing and you're customizing treatment with this approach. So the 2 MIRAroller sizes, one for the face, neck, jowls, hands, then the skin areas, if you will, and the other for all parts of the body. And there's so many things you can treat. I mean, it's texture, it's scarring, it's acne, it's just quality of skin, and on and on. So by combining both technologies, the MIRAroller infuses therapeutic serums deep into the skin, down to the DE junction sources. So here you can see some before and afters. Compare this to all the other stuff out there, and everything does something. Obviously, it wouldn't be out there, but nothing does all the stuff this does. Microneedling, microdermabrasion, low-level light, delivery of serums at the same time. So in summary, this really is a revolutionary system. It's going to be part of all of our offices because it does so much. Our docs like it, our PAs like it, our estheticians like it, not in Jersey because we can't do it, but in Manhattan we have our medical assistants doing it. MIRApeel system is an efficient transdermal delivery system. You apply these MIRAjoli cosmetic serums through the MIRAroller and the MIRAbrazier, the microdermabrasion and the microneedling device. That gives you healthier skin and it gives it a glow. And then the LED technology, which I really believe is a great adjunct, improves both acne and sun-damaged skin. So the MIRApeel system is safe for all ages, all genders, every type of skin, young, old. There's almost nothing I can think of that it's not going to do something to. And boy, is this helpful. And boy, is